The key to accurately coding the transfer of health items at discharge is correctly applying the term subsequent provider. Even if your facility provides a reconciled medication list at discharge, you may have to code 0 no for A2121 or A2123. Let's clarify the coding for these items. To code 1 yes for A2121, two things must be true. The patient was discharged to a subsequent provider, and your facility did provide a current reconciled medication list to that provider at the time of discharge. For example, let's say your facility discharges a patient home with no home health or hospice services and provides them with a copy of their current reconciled medication list. How would you code A2121? You would code 0 no, because they are not being discharged to a subsequent provider. What if you also send a copy to their community physician when they are discharged home? You would still code 0 no, because their community physician is not considered a subsequent provider. Even though patients may receive care from primary care providers, other outpatient providers, and residential treatment centers after discharge, these are not considered subsequent providers for coding these items. A subsequent provider is based on the discharge locations found in the IRF-PI in item 44D and in the LCDS in item A2105. Now let's look at A2123. To code 1 yes, two things must be true. The patient was discharged home, not to a subsequent provider, and your facility did provide a current reconciled medication list to the patient, family, or caregiver. If your facility discharges a patient home with home health services and provides the patient with a copy of their current reconciled medication list at discharge, how would you code A2123? You would code 0 no, because even though the patient is going home, they are being discharged to a subsequent provider, home health services. Communication of medication information at discharge is critical to ensure safe and effective transitions from one healthcare setting to another. Now, let's review. To code 1 yes for A2121, two things must be true. The patient was discharged to a subsequent provider, and your facility did provide a current reconciled medication list to that provider at the time of discharge. To code 1 yes for A2123, two things must be true. The patient was discharged home, not to a subsequent provider, and your facility did provide a current reconciled medication list to the patient, family, or caregiver. Therefore, when your facility provides the current reconciled medication list to the appropriate party at discharge, you will only code 1 yes for either A2121 or A2123, not both, depending on whether they were discharged to a subsequent provider. For more information, please consult the IRF-PI or LCDS manual.